Hello, my name is Dr. Ray Sterner, and I would like to introduce a unique approach to clinical decision support called the Patient-Specific Template, which provides moment-of-care decision support related to specific patient issues, not just a general content area. CHADIS is introducing this approach first to a very challenging clinical issue, addressing the social determinants of health during the course of a routine well-child encounter. Later this year, you will see application of the patient-specific template to children with ADHD and asthma. This first example should enable you to help some of your most distressed families and their at-risk children, and also to develop a new clinical skill which could be recognized with MOC4 and CME credits if desired. There are a number of AAP recommendations that address conditions that are associated with family stress and have come to be known as the social determinants of health. These conditions are more common in poor families, but not exclusively so by any means. Some of these factors recommended by the AAP for screening and assessment that we will address include parental depression, addiction, intimate partner violence, food insecurity, and harsh punishment. Fortunately, we now have considerable evidence that one general clinical approach has been shown to have a role in improving clinical outcomes in all of these varied clinical issues. This is MI, or motivational interviewing. The approach is really quite simple. In theory, it's about talking to individuals in a way that helps them explore and resolve their ambivalence about making behavioral change. That is not just giving advice, but acknowledging both the pros and the cons of making the change, and realizing if the reasons for not making the change, the cons, are not fully acknowledged, then the individual's mind is not fully available to listen to the good, logical reasons for committing to change. There is solid evidence for the efficacy of this clinical approach for a variety of challenging health behaviors. However, MI has had only a very limited adaptation in the primary care arena. There are probably two reasons for this. One is the time required. It does take longer to do motivational interviewing than to give simple advice. Then there's also the training required. While the concepts are really quite simple, there's practice that has been deemed needed, and workshops and training programs for clinicians have evolved. And part of this is even practicing the specific phraseology that has been shown to be effective in talking to these patients, and possibly reversing some of the habit patterns that clinicians have developed in becoming the so-called advice-giving machine, as they've been accused of being. This SEEK is a 14-item screen that was developed by Dr. Howard Dubowitz and his colleagues at University of Maryland, covering food insecurity, parental depression or extreme stress, harsh punishment, intimate partner violence, or substance use. This research team has conducted 2 randomized trials and developed evidence for reducing child maltreatment outcomes when used in primary care. The clinical challenge here is to approach a parent who's come to a well-child checkup for shots for their child and an examination, but certainly not to talk about their own private sensitive issues, which they're liable to be quite ambivalent about doing so. So how does CHADIS overcome some of these obstacles? So using the SEEK example, the pre-visit experience of the parent doing the questionnaire capitalizes on time before the face-to-face encounter. We have taken the screen and introduced something we call the SEEK Plus. There are follow-up questions that probe areas of their potential motivation. How impactful is it in their life? What barriers are there? How ready are they for change? And then we're going to help with time efficiency by creating a documentation before the visit even starts from the pre-visit questionnaires and to facilitate auto text documentation. CHADIS also leverages time after the visit through the individualized messaging to the patient via Care Portal or handouts with even the local referral information. Training is addressed by CHADIS through the moment of care, patient-specific template, and manifests itself with teleprompters which provide specific phraseology. This is something like the President of the United States uses in giving a speech to practice the words, and there are hints on the clinician interface. And then there are additional optional supports for doctors who have had their curiosity piqued by the visit, looking at e-chapters, video examples, other clinician resources, and practice through an MOC4 training program. So now we're going to look at a typical example. Mother of fictitious Sam Jones sees the Seek Plus questionnaire with this introduction, endorses the question about being stressed out, feeling depressed, and having little interest in things, saying this is impacting on her work and taking care of the home. CHADIS asks if she's getting help. No, she's not getting help, and she doesn't want help. And the main thing that's getting in the way is that she feels that she doesn't want to take medications, which is what she associates with getting help for depression. A stage of change question reveals that if things were to continue, she might go to family members for help. Now we're looking at the clinician view where CHADIS gives a heads up before the patient encounter. We can see that there's a positive parental depression screen, and the option there is to begin the PST, and this is the environment of the PST now, and there's some red alerts for the stress depression area and specific questions that have been endorsed. The teleprompter above the tab provides some words that might be useful in beginning the conversation. The right sided panel shows some documentation that's already there based on the pre-visit questionnaire. The doctor clicks on the stress depression tab and gets some teleprompters related to getting the discussion started about, I see you reported feeling a lot of stress and feeling down, and then clicking over in the barriers and readiness area brings up the central crux of motivational interviewing, reflecting on the cons for change, weighing the pros and cons of making a behavioral change with some specific words that might be useful. I see not wanting to be on medication is holding you back from getting help. I understand lots of people don't want to take medication. Some words that may help grease the moment. And then if the patient engages, we could go to the plan section where there are a number of dispositions that could be discussed with triggering first be available to the parent, as we'll discuss. There are a number of hints. This is one that says, talks about CBT, has evidence-based approach to addressing depression. Now we're ready to take a look at the handouts. Handouts are in quotes there because it also includes an electronic communication, and we are going to then be able to view the resources that are ready to go to these kind of handouts. Here are some examples, and we click on the Care Portal tab and can see some paragraphs that are sitting there ready to move forward with individualized information, including the doctor's name. You can unclick these. You can also type in your own notes if you want to, and we can get a preview of this information that could be printed as a handout or, as we'll see in a moment, sent to the Care Portal text. We're now selecting the mother as someone who we will be sending Care Portal text to as we lock the screen and then be able to have the documentation ready for a transfer to the electronic medical record or printed for a printed record. This view is that of the mother looking at the Care Portal memory book and sees that there are some visit notes and resources for her, and there are some headlines of the information that you can click on and see the paragraphs and handouts that we saw earlier. Here you can get an idea of the kind of documentation that can move on to the patient's record. If so motivated, the clinician can pursue this area of content through an electronic chapter, or visual learners can see it in a video portraying some of the content as seen in the screenshot, and there are a number of case examples that can be reviewed. This shows a electronic chapter. It's put in bulleted form. If you click through, you can also get to recent research reports. This slide illustrates a run chart, the kind that is required by the American Board of Pediatrics for MOC4 credits, and this can be created for CHADIS users as well. This slide shows a detail of a quality improvement report showing the number of the percentage of positive depression screens that were consummated with a interview. Well, thank you for your time and attention. If you have any questions or comments, please get back to me.